Good day everyone! Today, we're diving into something every vet med student needs to know. How to write and understand a veterinary prescription. While it may seem routine, writing a clear, accurate, and legal prescription is critical for ensuring patient safety and effective treatment. It's not just writing down meds. It has structure, rules, and legal parts we need to follow. What is a veterinary prescription? A veterinary prescription is a legal document written by a licensed veterinarian. It allows a client to get medications for their pet or livestock. It needs to be clear, complete, and accurate. Poorly written prescriptions can lead to medication errors, adverse effects, or even legal consequences. So here are the parts of a prescription: the date, the patient's information, subscription, inscription, subscription, signature, renewal instructions, and signature, address, and registration number of the prescriber, which will be discussed one by one. The first part is the date, which is shown at the top left or top right. The purpose of the date is to know when prescription was written. Now this is very important for several reasons. One is for legal validity. Prescriptions have an expiration period. For example, controlled substances may only be valid for a few days to a month, or regular prescriptions often expire after 6 to 12 months. Without a date, pharmacists may not be allowed to fill the prescription. Another is for treatment monitoring. The date helps healthcare providers and pharmacists track when treatment started. This is crucial for antibiotic courses, chronic medications, and follow-up scheduling. The date also prevents misuse or fraud. A missing or altered date could lead to prescription fraud, such as using the same prescription multiple times.
Next, let's look at the patient information. This includes the pet's name, age, sex, address, and its owner. Accurate identification is vital for proper treatment. Age, for instance, affects dosage, while sex can influence certain medical decisions. Now, we move to the superscription. This part includes the date, the patient information, and the RX. RX is an abbreviation of the Latin word recipe, meaning take thou. Next is the inscription. This is the heart of the prescription. This section details the name of the drug, its strength, and the dosage form. For example, 500 over 125 mg of amoxiclav. Following that is the subscription. This part provides instructions for the pharmacist on how to prepare or dispense the medication. For example, dispense 20 capsules.
Signature. Sig is an abbreviation for the Latin word signature, which means let it be labeled. The sig consists of the direction to be given to the patient regarding the administration of the drug. Instructions may include the quantity to be taken, frequency and timing of administration, and route of administration. For example, give 1 capsule orally twice a day for 10 days. Next are the renewal instructions. These indicate whether the medication can be refilled or renewed, and if so, how many times. For example, the prescribing veterinarian may indicate no refill or may refill once. Finally, we have the prescriber information. This includes the veterinarian's signature, address, and registration number. This information is necessary for legal and professional accountability. Before we get into the strict stuff, let's talk about regular prescriptions first. Non-controlled substances. These are your everyday meds like antibiotics, dewormers, vitamins, stuff that's not regulated under dangerous drugs. To write these properly, your prescription should include date of issuance, name, age, sex and address of the animal or patient, species of the animal, name of the drug prescribed, dosage form and strength, quantity prescribed, direction for use, refill instructions if any, and the name, signature, address, and PRC license number of the prescribing veterinarian. Now for the more sensitive part, controlled substances. These include meds like ketamine, diazepam, morphine, and others under the Dangerous Drugs Act. Here's what you legally need to include: date of issuance, name, age, sex, and address of the animal and the owner, species of the animal, generic and brand name of the controlled drug, dosage form and strength, quantity in words and figures, complete directions for use, duration of treatment, explicit statement for veterinary use only, name, signature, professional address, and PRC license number of the veterinarian, PTR, or the professional tax receipt, and S2 license number, which is required for controlled drugs. Original copy must be kept by the pharmacist, and the duplicate copy retained by the prescribing veterinarian for record. Now, let's go over the Latin codes that we all had to memorize. At first, they look intimidating, but they're actually really useful once you get the hang of it. To wrap it all up, knowing how to write a proper veterinary prescription is a skill that every future vet needs. It's more than just choosing the right drug, it's about being accurate, legal, and professional. One mistake in dosage or a missing detail could mean the difference between healing and harm. So let's do it right every time. That would be all, and thank you for your attention.